Bloomfield Hills, Michigan. So I have a nice patient from Florida. Very interesting case. She's 60, mid 60s, 64 years of age, and she had her first set of implants at age 22. These were supposed to be saline above the muscle, and then she ended up getting another set in 96, another one in 97 because of the capsular contracture, and then another one in 2002, and they were replaced. And so she comes in with what is a severe capsular contracture, literally hard like a rock on the right side and also on the left, and she had what was inflammation that was very apparent on her exam. She also had an ultrasound that showed what was a snowstorm appearance. Again, snowstorm appearance meaning what was suggestive and indicative of what is a ruptured silicone on the right side. And so she had the complaints, and hence her presentation here, kind of in an expedited manner to get this addressed. So as you will see, 100% total capsulectomy, 11,425, initials VS. This is the excess skin that I removed, grade 3 capsular contracture. And overall, everything went very well. This is, you can see the color of this implant, and it has this brown tinge to it. Now, as you can see right here, as I was dissecting, there was this is the cartilage part of the rib right here. As you will see right here, cartilage part, cartilage. You can see another cartilage part of the rib. This is right on top of the rib underneath the muscle, which is indeed the hardest part. So there was this inevitable break, if you will. Otherwise, everything was done in contained fashion. You can see another imprint of the cartilage right here. And so the fascia of, you can see the fascia right here of the intercostal muscle. Right here, you can see right here, the fascia of the intercostal muscle was removed completely. I'm going to actually get like a nicer, finer pickup. Right here, the fascia. This tells you that the entire implant capsule was removed in what is a very defined way. And everything went very well. And now I'm going to go ahead and cut this open. Just out of curiosity, we'll see what this shows. And very thick, very tough case. And you can see no need for drains. I'm going to go in and look at this yellow tinge to this implant, and it has what is a hemorrhagic component to it. Look at the blood clot right here. None of this spilled into the chest, and I'm going to drop it right here. It was, as you can see right here, relatively very thick. A lot of inflammation noted in and around the tissue as well. So if I scrape this off, you will see there is crud matter. You see this? It was all contained. None of this spilled into the chest, hence no need for drains. And this is where all of this tissue was removed. Not in envelope, but still what is in a very controlled fashion, such that none of this spilled into the chest. And I'm overall very happy and content with how the whole dissection has gone. So what I'm going to do here is I'm going to go ahead and send this along with the capsule. I'll put this away. And then I'm going to look at the implant here. Not enough fluid to send off. Look at the, it's very interesting. Look at the inside. It looks as if some of it has made it on the inside. So very interesting. I'm going to go ahead and get this. You see how, I'm going to put it right here. This is the right chest mass. I'm going to send separately. So if you look over here when I press, look at this. And you can see how that fluid, the blood, whatnot else tracked into the inside. So indeed what I'm going to call this is a focal ruptured implant. And this is how the blood has made it on the inside. This is 375cc implant, 375 written on the back. So as you can see right here, how this hemorrhagic area tracked on the inside, and look at the color of this. So this is also important. Whenever we have seen any ruptured implant, you see the color of it has changed, and it is opaque. The entirety of it is opaque. And again, as you will see right here, the shell is made up of a different material than the inside. I'm going to go ahead and change my top glove. I'm not going to touch this because I don't want to cross-contaminate this area. And I have a new pair of gloves. So sterile gloves. So this is the left grade 3 capsular contracture, left chest mass. I'm going to send that separate. That was on the periphery. And as you will see, entirely done in end block fashion, end block, all contained, and we'll see what this shows. This was an extreme challenge to remove, especially the way it was stuck. All of this inflamed tissue here has been removed. You can see it does not have that brown tinge that this, the left one does not have the brown tinge that the right one has. So as I go ahead and dissect over here, let me find a better way to enter. Remember, you can see like right here, this is the cartilage part of the rib, and I'm going to enter from here. This is the part that is the hardest part of the case. And lo and behold, this is indeed very much ruptured as well. And this patient talked to me not too long ago, and I told her there was an urgency because of that snowstorm appearance on the ultrasound, on the imaging that she had. So ruptured implant, end block, the gold standard. Everything contained, none of this spill into the chest. And you can see very thick capsule. And total surprise that this one is ruptured. Given the length of time that she's had it, almost 23 years, not uncommon. And as you will see, if I take my instruments, you will see this. It's like plaster of Paris that's breaking off. And none of this spilled in the chest. And we're going to send this off to pathology. And the other thing I want to show here is it's relatively very thick. As I cut it, my scissors bent. I do not know if you saw that. That's how thick this tissue is. So what is here is all contained badness. She has a history of four implants. And I'm going to put this right here. And then let's go ahead and look at this implant. And again, I don't want to contaminate or involve that other mass, 375. And you can see again, look at the color of this. There is nothing. This is back in the day in '02, the silicone implants were banned. As you can see right here. So the goal here is, look at this again. Everything overall contained on the right and also on the left. No need for drains, no need for that unnecessary lift at this time. She is overall going to do very well. This is like the con procedure. The entire implants, right and left, will be sent to the home with the patient. Cultures for aerobic, anaerobic, and fungal. The entire capsule tissue on the right and left sent separately to pathology, rule out that rare BIAL, CD30 analysis, rule out lymphoma, rule out malignancy. Cultures for aerobic, anaerobic, and fungal. Twilight deep sedation. High definition pictures and videos of not only this cutting open on the table, but also more importantly off the chest wall, showing complete removal of the implant capsule. And then this is where the patients will have had a complete workup and a complete evaluation so that we know what we're dealing with and what we're not dealing with. Lastly, I want to go ahead and invite all of you to a very interesting, unique Facebook Live where I'm going to sit down with Dr. Alex Omar, my anesthesiologist, so that we can discuss and answer any questions you may have. Please feel free to ask any questions. You can text them or type them onto the Facebook page or the YouTube or TikTok or Instagram. And Dr. Omar will be very helpful in helping us understand any questions that you may have. This is Dr. Khan, Executive Plastic Surgeon.